So the 2014 Alberta Pandemic Plan has these 4 goals. These were the 4 goals intentionally given equal weight in our Alberta 2014 Pandemic Plan. You can read them for yourself, but in a nutshell, 1 is stop people dying. Number 2, stop social disruption. Number 3, don't have adverse economic impact because you're going to have to pay for everything that you're going to do later. And number 4, support an efficient and effective use of resources. The Emergency Management Agency could bring together all the best minds in Alberta, run through the process for the specific virus that was coming at us. The end state of that would be to publish a written plan that every Albertan would see. They would know how their life fit into the plan and therefore could understand their role very clearly. The other point is, before you deny rights under the Charter of Rights and Freedoms, you have to follow a process called due diligence. If we are going to limit freedoms, here's exactly why. And this is how we know what the end state is to get out of this. I put it to you, first of all, the plan has never been issued in any province in Canada, let alone Alberta. And therefore, the public doesn't know what the triggers are, and they don't know their role very well. And there is great confusion because the plan seems to change every day. So basically, I think the response in every province in Canada has been incoherent, constantly changing, and because we placed the medical officers of health in charge, they specifically focused in the one area that is their area of expertise, which is the comorbidity and death. But I put it to you, and I will show you why I believe we've even failed at that one, and we completely ignored the other 3 goals. This statement of fact that I found here, I knew in February. And basically what it says is 95% of the people that were dying of COVID in Italy, in Spain, and in China were over the age of 60 with severe multiple comorbidities. This is one of the weekly WHO documents, and they're still there. You can still Google them. Again, 95% of deaths worldwide over the age of 60, severe comorbidities, and they even listed by week which were the most apparent comorbidities. So the way emergency management works is you first collect data. There's the data. The second thing you do is you look at the hazard and you look at who's most effective. 96% of the deaths in Canada have been in seniors over the age of 60 with severe multiple comorbidities. The average age of death from COVID in Canada is 84 years old with at least 3 comorbidities. 73% of all deaths in Canada were in our long-term care homes to date. The first thing we need to do is to quarantine our long-term care homes. If we had, we could have saved 73% of the deaths. Quarantine means the staff and the residents. We, here in Canada and in Alberta, ranked last in the OECD developed countries in care for our seniors in this pandemic. I will bet you back in March that if we had approached both the owner-operators, the unions, and the staff, we would have had overwhelming support to develop an option to build that quarantine plan, and we would have been able, definitely, between the first wave and the second wave, to recruit. We've spent over $400 billion to force perfectly well people to lock down and stay in their homes in order to save our seniors. It didn't work. If we were trying to develop concepts and plans so that the staff would have minimal impact, right in March, one of the first things we should have done is focus on rapid testing so that we could at least let the staff go home and we could allow other visitors to come and we could test to make sure that they weren't just asymptomatic coming into the home. That's what happens when you don't bring all the minds together at the start of a pandemic and you give it to one subject matter expert and expect them to know how to coordinate across everyone. Now, we're constantly told that our medical system is going to be overwhelmed. But that same demographic, the people over the age of 60 with multiple severe comorbidities, are still, to this day, Stats Canada stats, they're the ones that are filling up 71% of our hospital beds and 65% of our ICUs. if we had developed an option for both our long-term care homes and for our seniors living in the community with severe comorbidities. Start with the people who have 3 or more. They could have helped develop plans for either in-home quarantine systems or quarantine systems offered in a government facility to try and minimize the number of them that would have died as well. In my opinion, we completely ignored the other 3 goals of the Alberta 2014 plan. We've seen massive impacts on our social fabric, our mental health, other severe health conditions, our children's education, and our economy. You can't add almost double your national debt and not see the servicing of the debt and the ability to transfer payments to provinces not have a catastrophic effect. This was peer-reviewed science from the first wave. Read the conclusion. While small benefits cannot be excluded, we do not find significant benefits on a case-by-case growth of restricted non-pharmaceutical interventions. What they did in that study is they compared in similar climate regions countries that had no lockdown to countries that did massive lockdown. They showed the spread of the virus in places like Belarus, which thought the whole thing was a joke and did nothing, and compared it to the UK, and you know what the UK's done in terms of lockdown. I give you Sweden, who have not closed their schools other than for 2 brief short periods, only for their equivalent of grade 11 and 12, and they have never ordered a business to close. And compare that to Quebec, and you will find that Quebec with massive lockdown and Sweden without lockdowns, the actual deaths per capita are identical. But certainly their young people have not been affected. They've gone to school, they've run their businesses, they've carried on every day. And this study does this worldwide. It's peer-reviewed science by infectious disease doctors. So what do we do now? We're here now. We have to live with what's happened. First thing in my mind is we can never let this happen again. And that's why I keep doing these presentations, even though me and my family are being attacked routinely. Number 1, we better see out of our governments, every single province and our federal government, a written plan showing us what they're doing from now on. Number 2, we still have not protected our most vulnerable, seniors at risk, both in the general population and in our long-term care homes. We need to vaccinate them, yes, if they choose to be vaccinated, but we need to make sure that we have a plan for them until we can get to them all. Bullet 3, we need to make sure all our critical infrastructure is ready. Here in Alberta, at one point we were up to 890 admittances. The best numbers I can find, and it's really hard to find them, is we have over 9,000 acute care beds. It's not overwhelming our medical system, and if it is, it's because we didn't develop surge capacity that we should have developed in March, both in terms of infrastructure and staff. And part of the problem is we keep sending healthy people home, a non-pharmaceutical intervention strongly recommended against. Number 4, remove the fear campaign. Did you know that in its first year, worldwide, COVID killed 1.9 million people? Terrifying number. Do you know that pneumonia, every single year for the past 5 years, has killed 2.54 million people? Google it yourself. COVID compared to pneumonia, not as bad. If you're between the age of 20 and 40 in Canada, you have a 5 times higher chance of dying in your car driving to work than you do from COVID. The denominators, the comparisons are never given. And people say if we hadn't locked down, the numbers would have been greater. I want to take you back to that study that I showed you that shows case count. You can't tell the difference between a non-lockdown country and a lockdown country. Bullet 5, end all talks of future lockdowns. We know from previous lessons learned and now from studies on this that lockdowns do not have a significant effect. We guarantee our schools will never be closed again, period. You send sick people home, you don't send healthy people home. My granddaughter in grade 11 has been sent home 3 times since September for 2-week lockdowns, and the actual instructions from the school board is she's to stay in her room, have her food delivered to her door, and use a separate bathroom from the other members of the family. Number 7, anyone who's under the age of 60 without pre-existing comorbidities should be sent back to work. The collateral damage we have done is going to last at least a decade, in most cases a full generation. My last point, vaccines. Come October, there will be, I'm guaranteeing you, just like every year, there will be another wave of COVID along with everything else that's seasonally variant. And there will be a move to close our schools, to close our business, and to try and do this all over again unless we learn the lesson. 2 parts. COVID kills people over the age of 60 with multiple comorbidities. We need to protect them. The other side, non-pharmaceutical interventions do not significantly impact the spread of the disease. Don't use them.